I've worked in Indian country for almost 25 years now. This is a program that is vital to our communities. It's, without a doubt, in my opinion, one of the best programs we've ever had. It changes lives. And I'm proud to be a part of it. I've been a part of it from the very beginning. We wrote the grant. We came to our first grantee meeting. We worked as a team of folks. We collaboratively worked together to design the program. I'm real proud of it, and I've seen the results of it. So I'm really honored to be a part of designing the tail end of this now, where we get the modules together and we share it with the other tribes and the rest of the country so they can benefit from what we've learned.
No matter what we look like, what size we are, where we come from, that when we really understand what this disease is doing to our people, we all have that same hope, is we want to see a future without this disease, a future without the threat of this taking our children or taking our lives. And the Diabetes Prevention Program gives us that hope.
This program is life-changing. It's community-changing. It's changes the way that families and individuals think. It's what's needed in the next step of creating healthy communities and our healthy tribes. So I knew this was important. We've put a lot of time into getting where we are. We've been super successful, each individual person. I mean, chronic diseases have been prevented, not just diabetes, but hypertension and obesity. So it just seemed logical next step is that you would disseminate the information and make it as easy for other people to follow.
We're providing them with life-changing education that will help them and their families to better know how to prevent diabetes. Many of them did not do any type of exercise, but because of the program, they're involved with their families again. So it's not just about the person that's in the program. The whole family is impacted by our program.
Being part of the Diabetes Prevention Program, it really was something that was very close to my heart, just due to the things that have happened to family members regarding diabetes. It was something that at that time I really wanted to find a position and find an area of work where I could focus on prevention, and it came at the right time, and for me to work with my tribe in doing this has meant the world to me. Diabetes prevention is actually so much more than just losing weight. It provides skills for people to really change their lives and eat healthier and move more to where they feel better and to where they really feel good about themselves.
Our tribes are very proud of the work that's been done, and more importantly, it's saving the lives of people. And it's information that needs to be shared with everybody, not just tribal communities, but all of our partners across the state, federally. And it's really important that we get to the end, we get the toolkit finished, and that we present it in a manner that folks can understand. It's easy to follow.
DPP really is a successful tool, and the toolkit is something that will really help your team or help Native communities prevent diabetes.
I can tell you now, having been through the program, this program has changed the way that our tribal leaders, our elders, think about healthcare. Healthcare is a #1 priority for our tribe at this point. The diabetes program, the prevention program, is what basically sparked that. And in light of the transformation changes in the country and everything happening, we're a huge part of that in our community and in our state. And this program has really become, the results are so astonishing that folks from the Oregonian, from the Oregon Health Science University, from local hospitals all call us up and ask if we'll come and share what we know, the knowledge that the tribe has gained from our very small input into reducing the diabetes epidemic, the obesity epidemic, and our tribe's proud of that. But they're more proud that this has changed our community. This has changed the way our families eat and how they exercise together. We have a garden now. I mean, it's really, really blossomed into something huge, and the tribe's very proud of it. So we will be maintaining the diabetes prevention program.
I'd like this toolkit to empower our Native American people to look at diabetes differently, more positively, and prevent diabetes in our communities.